Welcome back to another fun-filled presentation on sleep and children. Let's talk about the common childhood conditions that you may come across in the sleep lab. These can either coexist with sleep problems or without, intrinsically. Sleep apnea, can be caused by many things, and for a lot of people, it starts at birth. There are some common childhood disorders that when you run studies on them, you should know a little bit about what you're trying to look for every time you hear these conditions. Asthma is very common, and bronchial asthma is just asthma, but it's a little more specific. But it is a reaction to something, typically an allergen. Uh, and it's the narrowing of the bronchi and the bronchioles. The narrowing is due to mucosal swelling and contraction of the muscles in their walls, and that makes it hard to move air. And these flare-ups can be caused by allergens like dust or pollen. In the sleep lab, you have collodion, sometimes exacerbation from exercise. So really, when it comes to the allergens, that's the body's way of saying, oh, I don't want any more of this allergen in, so I'm going to stop you from breathing them in. That's the body's way of saying, I don't want any more of that coming in through the lungs. It can affect about 10% of children. Most patients will have their first symptoms before the age of 5 years old. At least half of the cases stop reporting attacks once they reach adulthood. Symptoms of an asthma attack include recurrent cough, wheezing, shortness of breath. Shortness of breath is also abbreviated SOB, and it is also common as it's also another symptom of asthma if the patient's symptoms become better with a bronchodilator. It further gives evidence that it is in fact asthma. If it was something else, the bronchodilator would not work. Bronchodilators, like albuterol, reverses the muscle contraction of the bronchioles, which is technically called a bronchospasm. Albuterol can be administered with a rescue inhaler, also known as a puffer, or with a nebulizer, which is a little piece that you hook up to an oxygen concentrator, and it doesn't vaporize because there's no heat, but uh, the fluid it makes it really tiny, effervescent almost, so that you can breathe it. The signs for a severe asthma attack and some that you might consider calling emergencies uh, for would be severe drowsiness, not able to move very well, you're so tired, cyanosis, blue lips, and shortness of breath when speaking. Yeah, I've had asthma patients like that, and I've sent a few to the hospital because I wasn't comfortable with them uh, being like that in the sleep lab. If it was something like shortness of breath, you can't breathe very well, even just sitting down and talking to me, that's not good. I'm not really comfortable running a sleep study on that kind of person. This is what it would kind of look like when an asthma patient has a flare up. Here it's nice and open, then here you can see it's really occluded by this extra tissue, and it can be fatal if it's a severe case. You can encourage the child to sit in an upright position. Cooler air is better. Get them out of the environment if it has a smell or if it has allergens in it. Uh, if it persists, urgent treatment. Use the patient's medication. Sometimes your lab will have some respiratory medication. Cystic fibrosis is a chronic disease that frequently, at least in the past, killed most of its victims pretty early in life. We're talking 25, 30, and under. That was about it. Uh, Treatments have gotten better, and our understanding of when to take those treatments, how often it needs to happen, is helping. Due to a defective gene, CF happens because there's a sodium ion channel dysfunction that affects lungs and many other organs. The lungs are more popular. I guess people know more about needing lung transplants and things like that for CF patients. They're unable to clear the thick and sticky secretions, which and can obstruct the alveoli, where the tiny little bubbles that can close up, but that's where gas exchange happens. It can happen in all sorts of your tubes and ducts and passageways. The pancreas is in there as well. Not only does it obstruct, it can also catch and hold on to infectious agents. That's why there's a big risk for chronic respiratory infections and infections that you might get in the hospital. Uh, that's a big one with CF. Um, they're on multiple medications and breathing treatments. One of those treatments is actually a percussive vest they can hook up to an air apparatus, and it beats on their chest with vibrations and on their back to try and physically clear up these secretions. Before the vest, patients would actually have someone and clap on their front and their back, and that it would sound like this, and they would try to, really, that's what they would have to do to get all this stuff off, and they would try and uh, cough all this stuff up. These treatments must become an established routine for patients to have the best chance for good health. Uh, it, it affects roughly 1 in every 3,000 pregnancies, and both parents have to have the defective gene for it to happen. Proactive parents can get a genetic offspring test that would indicate if certain genes are carried uh, and are known to cause chronic illness like cystic fibrosis. My wife and I got tested for all sorts of things, and we uh, fortunately we're not carriers of anything that mutually would be bad. So you can do that, but obviously if you have a kid and you haven't gotten tested before, that's different. You can have the testing afterwards. Some of the signs of or symptoms of cystic fibrosis include overly salty tasting skin. In fact, the test for CF is the sweat test, which calculates the amount of sodium in perspiration. Uh, Other symptoms include the persistent coughing, at times productive, meaning you're coughing stuff up, frequent lung infections, wheezing, shortness of breath, poor growth, and weight gain despite a good appetite. I, in fact, knew someone when I was in middle school. There was well, she was 2 years ahead of me, but she had cystic fibrosis, and I didn't really understand what it was back then. But it was kind of a church thing, and she would give her testimony, as it were. And she died when she in her 20s. She did not last for very long. Um, and I'm not sure if she had access to medication and the routine, but it just happens that quickly with some CF patients. Their stories are all over YouTube, and that the same goes for many of these other um, disorders of childhood. Some people can live with ADHD and autism and things. CF will take youth very quickly. Uh, so they're not able to grow. They don't get good weight gain even if they eat a lot because the intestines are blocked by secretions, and so nutrients can't get in there. So sometimes they just poop out everything. Wonderful pink eye. Conjunctivitis, if you remember from your medical terminology class, puts conjunctiva, which is the transparent membrane that lines your eyelid and part of your eyeball, and itis, which means inflammation, together. It can be caused by bacterial or viral infection or caused by an allergic reaction. Patients will sometimes wake up and their eye is crusted over and kind of frozen shut. You can help that with a warm compress or a shower. The sclera, which is the white part of your eye, may be red and the surrounding part of the eye may be puffy. Uh, Patients may be contagious 1 to 2 weeks after the first signs and symptoms appear, but typically schools and child care facilities will require the child to wait at least 24 hours after starting treatment before returning to regular activities. Keep taking the treatment until it's recommended to stop. Regularly wash the bed sheets and sanitize surfaces regularly. Treatment is usually an antibiotic eye drop. Man, pink eye went through my family at the beginning of this year, and it lasted about 2 months. It went from my baby, well, she's 4, but she's always my baby, to me, to my wife, to me, to back to my baby, to my wife, back to me. Oh, it was awful. It's hard to get rid of. It's highly contagious. Head lice is a super common problem, especially for kids aged 3 to 12, and usually girls more often than boys. Definitely when they are socialized in childcare or school. Um, Lice are tiny parasitic insects that live off the blood supply to the scalp and lay eggs or nits. And well, nits, I guess, can be eggs and the little larva. Uh, they're highly contagious and being spread from head-to-head contact, sharing clothes, bed sheets, uh, carpet, plush toys, things like that. Lice can live up to 3 days off the body. And nits, the eggs or a small louse, can live up to 3 weeks off the body. And I guess it would make sense for girls to, especially in these ages, they like to play dress up together and braid their long hair together. Boys too, maybe, but traditionally girls with long hair are apt to do that with each other, and that's a great way to be contagious and share diseases like head lice. Conditions, I guess. A special medicated shampoo can help with the child. You can treat upholstered furniture with anti-lice spray. Usually, the thing to do is to nitpick. You just get a comb and a little thing, and you just go get them. Attention deficit hyperactivity disorder affects approximately 11% of children. Boys more than girls. That's uh, been documented at least. We should know that historically women are not either, they're either less believed or less accounted for when it comes to things, especially like pain. Women are not believed when they express to providers. As far as like when men do, they're more believed. That's just how it was, and things are getting a little better, but it's still women are still left out, big time in healthcare a lot of times. Uh, it's ultimately unknown what causes ADHD, but there are some correlations pointing towards genetics, maternal smoking or drug use, and exposure to toxins. Um, on average, people with ADHD have a 4% smaller brain than normative brains. Um, what does that really mean? Does it mean you're not as smart? Not really. Your brain shrinks as you get older and it gets smaller, but there's still people who are still as bright as ever as they get older. The exact chemical mechanism that causes all these traits, like hyperactivity, inability to sit still or pay attention, and impulsiveness, it's unknown. But it's postulated that some neurotransmitters aren't being used appropriately. Relating to sleep, ADHD mimics symptoms of disturbed sleep. If you've ever seen children when they get sleepy, sometimes they can get hyperactive, inattentive, and impulsive. Medications for ADHD include methamphetamines, which, if taken incorrectly, can keep a person awake. Down syndrome affects 1 out of every 800 births. Due to an abnormal division of the 21st chromosome, also known as trisomy 21, Down syndrome patients experience mental deficiency, speech problems, slow motor development, and a range of characteristics such as a short and stocky build, almond-shaped eyes, a protruding tongue, hypotonia, which is a lack of muscle tone. You might notice them being floppy. Some infants are born with heart and intestinal defects. The thing to know about these patients, especially in the sleep lab, are the facial deformities in their tongue make these patients very susceptible to sleep apnea. Um, I've had a few of these patients, and one of them had it was so bad, and they would grind their teeth every time that they woke up, rah, rah, and it sounded like he was mixing boulders in there. It was so awful sounding. Uh, and CPAP was the answer. He didn't grind anymore after that. Um, More now than ever, children are overweight. Over 20% are right now. Uh, 80% of these children will stay obese. Uh, the annual National Health and Nutritional Examination survey by the CDC found that one-third of U.S. children are overweight or are at risk of becoming overweight. In total, about 25 million U.S. children and adolescents are overweight or are nearly overweight. The potential effects of childhood obesity are multiple and all devastating. Emotional and social disadvantages due to the stigma of being overweight, hypertension, hypercholesterolemia, diabetes, heart disease, gallbladder, liver disease, and some forms of cancer. If the weight on these patients is great enough, it can cause hypoventilation because the muscles aren't strong enough to lift the weight on top of their lungs. Not to mention the excess tissue that's on their throat, uh, making the patient prone to sleep apnea even more. Capnography is a tool needed to properly diagnose hypoventilation. The CO2 readings will increase. Obesity is an ongoing problem, and there are many tangible and intangible reasons. Some people have eating disorders or eat to feel better about themselves. Children do not choose what they get to eat. They are beholden to what their parents or guardians give them access to. If that access is just a junk food, then the children is not likely to thrive. However, there are studies researching possible genetic components to the ongoing obesity epidemic. Uh, should children be able to take Ozempic and other drugs like that if they get type 2 diabetes? Type 2 diabetes, which used to be called adult onset diabetes, now children are getting that. Prader-Willi syndrome is a genetic disorder specifically affecting chromosome 15. It can manifest as hypotonia, floppy baby syndrome. If you ever see a newborn, they're kind of like a frog. Their arms and their legs are in, and if you bring them out, they go right back. But these are they just kind of hang down. They can have hypogonadism, which are underdeveloped sexual organs, short stature with small hands and small feet, delayed developmental milestones, cognitive impairment, uh, transient hypersexuality, and hyperphagia, which is irresistible hunger. The hyperphagia causes obesity in early childhood and tends to develop into diabetes by adolescence and adulthood. These patients are also prone to central hypoventilation, central and obstructive sleep apnea. Pierre-Robin syndrome, or Robin syndrome, uh, is a disorder that affects the craniofacial structure. The jaw exhibits micrognathia, or an undersized lower jaw, and the tongue uh, falls back and downward, and there's a soft cleft palate. The undersized lower jaw and tongue are crucial features that cause obstructive sleep apnea. You can see the jaw is very recessed. The chin is usually up here. There's usually more of a point, but it's far back. All of that affects all of the anatomy back here that makes breathing possible. And you're usually looking at surgical, if the severity is right, surgical intervention for something like that. Although uh, they might even require a sleep study for something like that to see how bad it is. Autism is an inheritable array of traits, ultimately that seem strange or bizarre in regular society. Because of the wide variety of traits and severities, autistic persons can be high functioning or low functioning. High functioning means they're able to live in society without much difficulty. They can mask their symptoms. Low functioning refers to those who may be mute, have severe social anxiety, or sensory disorders that prohibit them from leaving their residence. Sensory disorders include being overwhelmed at loud noises or bright lights. Colors can be overwhelming. Asperger's is a disorder that's considered on the spectrum. Some autistic traits also include stimming or repetitive behaviors or echolalia, which are repeating words that they've heard. Boys historically are 4 times more likely to have autism than girls, but it has been shown that girls are more skilled at masking their symptoms. And again, women have always had the short end of the stick when it comes to prioritizing their mental and health wellness. So likely they are underdiagnosed. Autistic people can learn coping mechanisms and tools to better fit into society. On the other hand, the autism spectrum has opened the doors to new technologies because of the different ways these brains work. Being autistic in no way means having low IQ. There is no standard test for autism. Autistic persons may also have trouble understanding language. They might find sarcasm difficult, tending to take words literally. If the autistic sleep patient has a sensory disorder, it might be difficult for them to tolerate an MPSG. I personally have never sent away an autistic patient without a decent study, though. Ankyloglossia or tongue ties are the midline deformities in children and are very common. I have one, never was fixed. The first sign of a tongue tie is usually mothers breastfeeding painfully. Because of the frenulum, the thing that holds your tongue down to the bottom of your mouth, if there's too much of that, it can cut off the tongue's mobility. The infant can't suckle properly, so it uses other parts of the mouth to compensate in attempt to get more nutrition, but it hurts the mother. It's not the way it's supposed to happen. Infants who are misdiagnosed or they can be malnourished if they're just having breast milk and they're not able to get enough, and they could be labeled failure to thrive if they don't meet certain milestones with weight and growth. Later in life, a person may have trouble speaking, playing wind instruments, licking ice cream, etc., things like that. But the big thing about tongue ties is the natural resting place for your tongue is against the roof of your mouth. And over time, that constant pressure elevates and shapes the roof of your mouth to its adult shape. Without this, the palate can be narrow and that can cause obstruction. When the tongue is not against the roof of your mouth, on the floor, which is right next to the airway, it's potentially causing an obstructed airway. I personally, try this yourself. How does it feel for the tongue? Close your mouth as the kiss your tongue at the roof of your mouth. That feels comfortable to me. Then try and put it down at the bottom of your mouth. It feels uncomfortable and I can't breathe very well. Uh, the tongue in its natural, relaxed, elevated position against the roof of your mouth, that helps your jaw stay closed and your mouth stay closed when you're sleeping. When the tongue is on the floor, the jaw is more difficult to hold closed. Therefore, the patient may sleep with their mouth open. The body is made to breathe nasally with its hairs for filtration, capillaries to warm the air, and mucosal membranes to moisten the air to make it ready for the lungs. Through the mouth, all that's gone. It's just normal dry air, and your tongues can get inflamed, especially if the obstruction causes snoring. A lot of pediatricians can see these enlarged tonsils and they're just ready to go get them. Let's take them out. But there's a lot of research pointing away from tonsillectomies because pediatrics, but they still use them regularly. The treatment for a tongue tie is a frenectomy, which is usually a laser that vaporizes the tissue. The younger the patient, the better. Typically, a week old is optimal. That sounds aggressive, but a breastfeeding baby needs nutrition, and there's really no time to waste, and there's usually a regression after that. So, in fact, my child had a tongue tie and had. This is basically written about my child, except for the enlarged tonsils part. After we got it done, she was able to feed no problem. Um, it was I don't want to say a miracle, but it was as close to a miracle as CPAP is. Uh, this is only a brief list of some common childhood disorders, but there are many that we haven't talked about. Type 1 diabetes, there's eczema, disruptive or oppositional behavior, and anger and aggression problems. Each patient is an individual and shouldn't be characterized just as their disorder. They're deserving of all the respect and dignity that any other person has. But it's important to know about these issues and how they might affect a sleep study and how to make you and the patient both more comfortable. So that's common childhood disorders. If you have questions about them, feel free to ask. I encourage you to do your own research. When I learned about CF a long time ago, I've gone in spurts of learning more and more about it because I find it absolutely devastating but fascinating at the same time. And I feel like just learning about it helps at least educate myself on what's going on. Uh, because those folks really need help. It's a terrible disease, just like any cancer or things like that. Uh, so I encourage you to look up these things and find your own way of noticing how common childhood symptoms or conditions can affect sleep. Until next time, sleep well, my friends.